Okay, good afternoon, everyone, and thank you for joining this afternoon for our State Learning Forum. Today, we're going to give you a brief update on the National Quality Initiative. We're going to discuss an excellent project that we're working on focusing on innovative finance case studies. And we're going to spend the majority of the time in a discussion with you about planning the State Learning Forums for the 2015-16 school year, discussing the frequency of emails and webinars and the content of what will now be quarterly webinars rather than monthly, which have been for the past year. And then we're going to discuss a few next steps. So I just want to start by introducing ourselves and who's on the call today from the School-Based Health Alliance. Erin Ash is our program manager. My name is Haley Love. I'm the Director of Research and Evaluation. Anna Measy is our Innovative Finance Case Study intern, and she's going to be asking for some of your thoughts and feedback on the work that she's doing to build these case studies. And Andrea Shore is our Director of Programs. She's going to be your direct contact for the next several months as it relates to these state program office webinars, quarterly webinars. So I'm just going to turn it over to Andrea quickly so she can introduce herself.
Hi, good afternoon, everyone, or good morning, depending on where you're located. Thank you so much for joining today, and I look forward to working with you. I've met some of you in person before, but I joined the School-Based Health Alliance back in March, for those of you I didn't get to meet in the past several months. And yes, with the departure of Serena Reckling and some shifting with our latest focus now and reshifting back to a variety of content areas with you all as you get some updates on where we're at with NQI today, we thought it would make great sense for me to be your liaison for a while and get to build some relationships there, and then we'll determine over time if that role remains with me or as we hire other staff members, if this role should fall under them. But for now, I will absolutely be an excited partner with you, and just want to call your attention as well to hopefully a posting you saw in the email that came out from us this week, that to remind you that we have a posting for an assistant director position that's on our programs team, and it's focused on school-based healthcare finance and business operations. So if you happen to have any fantastic people in mind that you would encourage to apply, we would greatly welcome that. But I look forward to getting to know you.
So now you've heard a little bit about us. We'd love to hear about you. So we're going to go through the people on the call. We're a small group this afternoon, but we would love for you to share something that's interesting, exciting, or awesome in your state, or if you prefer something that's exciting or interesting or awesome in your life. Feel free to share whatever you like. But maybe we can start with John. I wonder if you might be willing to start and share something from your state.
Sure. Hi, I'm John Bendis. I'm the Executive Director of the School Community Health Alliance in Michigan. Proud to say that the SBHCs here in Michigan, the 100 of them that are funded through the state, have Medicaid match, and I've been excited about that since I started working here less than a year ago. It sounds a little different from most of the rest of the country. And I'd say something awesome is I was mowing the grass last week and it snowed on me. It's getting cold, and the wind chill right now is about 23 degrees, so it's a little chilly here, even though it's not that cold, but the wind is blowing hard enough to make it cold.
Wow. All right, does anyone want to go next?
This is Kate O'Donnell from Oregon. I'll go next. I'm the Systems Development Specialist with our state program office here in Oregon, and we have a lot of exciting things happening here right now. One thing that I will say is today we are beginning a review of our state certification standards. So we have over 70 certified SBHCs in Oregon, and all sites must meet our state certification standards. And we're in the process of re-examining those and updating them a little bit for 2015. And another thing that we're pretty excited about is that a couple of our sites are piloting telehealth projects. And so we're really interested to see what the findings are from this year's pilot. And we'll hopefully be connecting with some folks to share some of our findings from that.
That's awesome. Kate, how frequently do you review your certification standards? Is that an annual thing, or do you do that every several years? Or?
It's every couple years. It really depends on what we're getting from the field. And our last review was actually pretty recently. The revised standards came out in 2013, 2014. But we just had heard from the field, and as our program has grown, that we were just really needed to kind of update our standards, particularly as more sites have gotten mental health providers on site and dental service providers. But prior to that, the most recent review was 2010, and I think before that it was like 2000. So it's kind of as needed.
Interesting. Would anybody else like to share something? I see Lakira Reddick is on the call and Melanie Porter. Lakira or Melanie, do you want to share? Hi, this is Lakira from Florida. How is everyone today?
Hey.
We're good. Thank you for joining. So just quickly, I'd just like to share that the Agency for Healthcare Administration in Florida has undertaken a complete overhaul and review of all of its coverage policies and limitations, manuals and handbooks, and that does include the school-based services. So we are actually in the process of updating and reviewing our current policies for school services and updating those as well as updating the other services that are provided through Medicaid as well. So that's just something that we here at the agency are working toward implementing over the next year. That's great. And Melanie?
Hi, it's Melanie. I'm with the Oregon State Program Office. And Kate pretty much covered a lot of our updates. Something new and fun with me is I just moved cubes. And I have a view now, so that's fun.
That's great. That's a big deal in the whole scheme of things.
It makes a big difference.
It's the little things. All right. Well, thank you, everyone, for sharing. So I am going to give a brief update on the project that we've spent the majority of the last year speaking with you all about, which is the School Health Services National Quality Initiative, an initiative to establish standardized performance measures for school-based health centers and to promote wide adoption of these standardized measures for reporting to the national office with the goal of having 50% of school-based health centers adopting and reporting these standardized measures by 2015. So on our last call, we talked a little bit about, now we have the measures, we've gone through this process that we are so grateful that you all have participated in. And what are our next steps? And so from that discussion, we have started to build a strategy for the 2015-16 school year to set some objectives around what we want to achieve. This project is ambitious, and we know that we can only achieve the goals set out by working together. So what we're going to do during this next school year is engage key stakeholders in this process of adopting and reporting the standardized performance measures. For those of you on the call who are more familiar with the initiative, the first group of early adopters have been selected through a competitive process, and they're going to participate in a learning collaborative. where they will help us test out these measures and be and form the initial data sets to build momentum for this initiative. The second stakeholder group that we want to work with over this next year are the state and regional program offices and state affiliate organizations, so your organizations, to have discussions around how do we do this together. And then some of you may have participated in the measure prioritization process. It was a 6-month process where we used a methodology where stakeholders in the field scored a set of proposed measures, and through that process we came to consensus on what we're describing as the 5 core performance measures for school-based health centers. So what this means for all of you is that over the next several months we're going to be reaching out to you to have individual discussions to discuss the process of and create strategies for aligning state measures with national measures, discussing the supports and resources and incentives needed to adopt and report measures, and the logistics of reporting data to School-Based Health Alliance. Many of you have some pretty awesome initiatives going on in your state. This is an excellent opportunity for us to align our work and learn from your experiences. So we'll be reaching out to you over the next several months to have these conversations to start to learn about how we operationalize this initiative together. Does anyone have any questions or thoughts that they want to share about this strategy? I'll assume that means you're just chewing on the idea of it, and that you will hear from us. We'll be reaching out to you to have these conversations. So now I'm going to turn it over to Anna, and she's going to talk about the work that she's doing on a project about innovative case studies. So Anna, do you want to take over here?
Yeah, great. So like Haley said, I'm Anna. I'm interning here working on the Innovative Finance Report, which is going to be a series of state case studies with the primary goal of making these strategies more accessible to the school-based health centers and our state affiliates. So if you can see the slides, I've got sort of the 4 focus areas that this report is going to look at up there, quickly going over that's allocated levies, wellness trust, and the hospital community benefit requirement, getting some funding from that. Going over each of them, sort of to give you a little blurb on each. When I talk about impact investing, simply I'm talking about the use of private capital for social good. Obviously, I'll be focusing on its use in social service delivery, and because it's sort of in its nascent stages, what I'm primarily looking at in the case studies is going to be sort of the technical aspects of how does it actually work. As for dedicated levies, that sort of speaks for itself. So I'll be looking at the 2 counties and how they navigated the process of getting this kind of thing passed. Third, we have wellness trusts, which are created to blend funding and centralize community wellness. These 2 are sort of in their developing stages. The statewide trust in Massachusetts is sort of the best example of this right now. So I'll be focusing on the building and maintaining of these kinds of partnerships with our state affiliates and with school-based health centers as well. Last, we have getting funding from hospital community benefit requirements. Here, I'll be looking at some opportunities for school-based health centers to get involved and get some funding, especially through participation in the community health needs assessment and the implementation strategies. So does anyone have sort of any first thoughts as to those 4 or questions about those 4? There's some questions up on those sides if you can see them. Does anyone have any examples of these strategies being used or of other strategies being used successfully in your state's?
This is Kate in Oregon. We've had several new centers benefit from dedicated levies. So bond measures that have passed that have gone to fund school renovations and school-based health center construction. This past legislative session, the legislature also dedicated a pool of money to match funds that were passed through a levy to support school construction. I don't have the dollar amount in front of me right now, but it was, I believe, several $million that folks would apply for to the state if a levy has been passed. And I believe it's during the next year and a half. And then they would be eligible to have a match from the state funds to support school construction. And school-based health centers are able to be considered part of that process.
Interesting.
Yeah, I hadn't heard about that. Anyone have any questions about the 4 strategies that I sort of outlined before?
Well, Kira, I know that Florida is a state where school-based health centers have used a lot of local innovative financing strategies to support the health centers in the absence of sort of robust funding from the state. Are you familiar with any of the approaches that they've used to support school-based health centers?
No, not really, not at this time. I'm not sure of any specific approaches that they use. I know that different counties throughout the state utilize strategies, but as far as specifically which ones they use, I'm not currently aware of any.
And John, Michigan's always a cutting-edge state. Is there anything interesting or innovative going on in your state related to this?
You know, other than the funding that comes through the Department of Education, I'm not familiar with the matching that any matching that they've done or creation of other types of funds. So I apologize, I don't have that information.
No, that's all right. Don't apologize.
Yeah. Does anyone have any insight into what might be preventing centers from taking advantage of these strategies? Whether it's just not knowing about them or not having the technical knowledge.
This is John again. My guess would be they don't know about them because we here have had a number of entities give us a call where we've directed them to MDHHS, where they're basically told, you know, there isn't any funding, we'll keep it on file, and then we try to develop relationships with them and bring them on as members. But you know, I haven't had any open discussion with them in regards to styles of funding. So this definitely interests me.
And this is Lakira from Florida. I would have to agree with John that the education piece on the different approaches, the schools may not be aware of those approaches.
Great, thank you.
This is Sarah in Oregon.
Sorry, go ahead, Sarah.
Sorry. So the hospital community benefit piece, I think, you know, I know it's something that our School-Based Health Alliance here has been working on doing some, you know, having some conversations with hospitals, and, you know, my sense is that that's a really political issue, and that there's a lot of folks at the table trying to understand the you know, the community benefit and the changes and how they might capitalize on it. But I think that and I don't know that much about it, but my perspective is that it takes a larger coalition of folks, like someone like the, you know, the state level alliance, or perhaps a conglomeration of counties, to really come together and tackle that issue together, that it's not something that could be done on a SBHC by SBHC basis.
Great. Yeah, definitely.
One thing, this is Andrea, that we talked about doing after this call. We'll send out these questions to the group and to those who could join today, and you all could think about it too. So if you have any colleagues that asking these questions might be possible, that would be great. Any feedback is in shaping this, or people that we could talk to who could lead us to someone else would be great. You know, we're really trying to figure out, just through word of mouth and individual research, who can we talk to. So we'll send these as follow-up, and you could certainly continue to stew on that. If you think of anything, please do let us know.
Yeah, I think Andrew covered it. That's what I've got.
Cool. Thank you, Anna. And more to come on this. So we want to spend a little bit of time now talking about these webinars, their frequency, and our email contact with you going forward. And how do we make this most meaningful for you all and not provide too much information or too little information. So our plan going forward now is that we'll continue to send you email updates from the School-Based Health Alliance monthly. Over the past year, you've received emails from a lot of different individuals on our staff who have been facilitating these webinars, but going forward, they'll be coming from the email address that's called states@sbhforall.org. So keep an eye out for that. It won't be a person's name, but from that webinar, from that email address. During, as I said, over the past year, we have engaged you all so intensely in many ways in shaping this national quality initiative. But now that the measures have been selected, the approach is shifting a bit, as I was talking about earlier, that we want to focus more on working with you one-on-one in order to have these conversations rather than the monthly webinars. And we think that it might be most efficient to have these sort of opportunities to all come together quarterly rather than monthly. So we're going to share a registration link for the webinars for the 2016 school year at the end of the webinar today, and we'll be emailing you with that as well. But the first thing that we want to talk to you about is the content of the webinars. We want to know what's best for you all. Do you want to have a standing agenda for the upcoming year? And if so, what should be a part of that standing agenda? Is it most useful for us to pull together some national updates, some state updates, and then potentially have a presentation, whether it be from a member of the Alliance staff on an initiative that we're working on, or one of you all presenting about something that's exciting in your state, which you would like the opportunity to have more time to share with the group. Does anyone have any thoughts on what they would like the webinars to look like? I think that they've taken different forms over the past 3 years that they've been in existence. So I don't know if some of you have been on them for that long, but have a sense of what you feel like has been most useful to you.
This is Lakira from Florida. I have not been a part of any of the discussions up to this point, but moving forward, I do believe that maybe an agenda with some agenda items or maybe action items would be sufficient with maybe the conversation moving forward. That's my opinion.
Okay, great. Anyone else who's participated on these in the past and have a sense of what you feel like has been most useful to you? All right. So this is going to be a speak now or forever hold your peace, at least until the next webinar, when we're going to take this approach that we will have a proposed agenda. We'll have national updates to share with you. We'll have we'll ask you to share state updates similarly as we did today. We'll have a survey at the end of this webinar, which is 2 questions, which asks you if you would be interested in presenting on a topic during the 2015-16 school year for 20 minutes during one of these webinars, and we'll circulate that to all of the other state program office representatives to start to generate some rich content for this year.
Haley, this is Sarah from Oregon.
Hi.
So I'm going to maybe out myself here as not having been clued in as much as I maybe should have been, but it feels like over the past year, 15 months or so, we've been talking about a lot, about the project and kind of, going through the evaluation process of the potential measures, and it feels like it's been very project focused, which has been great and really helpful. I think I'm struggling with, as a state that's not participating in the COIN, like how to sort of, well, first of all, are we supposed to be a part of these webinars? And second of all, if so, I guess I'm struggling with how to frame them in my head in a way for what's useful, because I feel like we've been very action oriented, and so I guess that's why I haven't said anything, because I guess I'm just floundering a little bit thinking about moving forward.
No, that's a great question. So this past year, I think, was unlike other years in terms of how and how frequently we interacted with all of you from the state program offices because of this initiative. And because the initiative has asked us to come up with a set of standardized performance measures, our lowest hanging fruit to start that process were the state program offices, who are already collecting a lot of this data. So we had a lot to learn. And because of that, we spent a lot of time focusing almost exclusively on this initiative for the past year. Previous to this past year, the webinars were quarterly, and they were the sort of focus was looser. It was more of a time to update, a time to come together for you all to have an opportunity to share ideas from your states and connect with other state program offices to learn about new things. And there were sessions where representatives from states presented briefly on a topic. So in some ways, this past year was incredibly useful for us, hopefully for you as well. It has been very NQI focused, but we're seeking to broaden it. So this call is absolutely not for participants in the COIN. This call is shifting back now to being focused on sharing all ideas across all topic areas, be it innovative finance case studies or the census or work you're doing in your state, to have this opportunity for all of you to share ideas, to keep you connected, to use this as a learning environment. So, so that's a great question, and probably one that others had as well, especially if they had participated over the past year in the NQI related work. So thank you for asking that. So really what we're looking for and hopeful to create is this environment where representatives from different state program offices feel like it's a safe environment and a supportive and helpful environment to come to learn about what's going on nationally. It will not be for the next year any focused on one specific initiative, though in our national updates we may share some updates from the National Quality Initiative. Is that helpful?
Okay. Yes, that helps. Thank you.
Thank you for asking that. All right, so in terms of our monthly emails that we'll be sending to you, which will be similar to the emails that we currently send out monthly, that consistency will, or frequency will remain the same. But we want to know what is similar to the discussion of making these webinars useful to you as a space where you can learn and be connected to what's going on nationally. We want those emails to serve a similar focus. So we want to ask you all now what would be useful to include in those monthly emails. Similar to our webinars for the past year, many of our emails have been focused on the NQI, though we've shared updates on the census and our convention and various different things. But what's useful to you guys when you receive those emails? Is the content do you read it excitedly, or is that one of those emails that just never gets opened because it's not all that valuable? And how do we move towards the former rather than the latter? I think maybe sharing a few national updates would be useful. We send out weekly emails to our state affiliate organizations that have a lot of information in them. For example, ideas about funding opportunities that school-based health centers might benefit from, blog posts developed by school-based health alliance staff on specific topics, news clippings that we pull from the web about SBHCs. And so would it be helpful for us to share this type of information with you? Is there other content that you say, I'm curious in understanding what's going on about this in other states, and it would be useful for us to be more strategic in what we share with you?
This is John in Michigan. I like the information that we get out of your office, and this most recent one with some of the webinars, I've already joined a couple, so I think the content's pretty good.
Okay, great, John. You're speaking to the state affiliate webinars? State affiliate emails, right?
No, I thought I got something from SBHC just last week that I'd signed up for one of the webinars. I thought it was yours.
It probably was. It's just that we send the state affiliates a weekly email called The Scoop. Sorry, is it weekly or monthly? Weekly. Weekly, excuse me. And there we include a lot of detail. With the state program offices, we have been a bit more judicious in our contact to not overburden you with too much information from our national office. And those are sent out monthly. And historically, we haven't included a lot of detailed information about our webinars or news clips or blogs as we do with our affiliates. So it's two separate types of emails to different audiences. But would this representatives from state program offices be interested in receiving more detailed information about our webinars, et cetera, et cetera?
All right, I got to admit I'm getting a little confused because I went back and I'm looking at it right now. It is the Scoop that I was looking at, and you're referring to something else. They kind of, in my mind, I don't pay much attention. I just see the emblem of school-based health, and I assume it's the same.
Yeah, and that makes sense. Do others feel that level of information would continue to be useful to have some of these bullet points up here? And including, I like how John shared, the webinar, we do have some learning opportunities that we could condense, posting coming up for the next month.
All right. Everyone's feeling shy today. So what we're going to do is we'll continue to be judicious in the type of information that we send to you. If we might expand it a bit to include a bit more information. So for example, some news clips that we feel like are very compelling. And if you haven't read them, this will give you the opportunity to if you'd like, as well as blogs. If there's a very relevant funding opportunity or webinars that we think would be interesting to your audience, we will include those.
This is Andrea. Just one question. I would definitely love to share the learning opportunities like John was saying. Do you all have active, I'm just curious, do you all have active listservs with the SBHCs in your states where you forward information, et cetera, like that, or do you tend to encourage them to sign up for our newsletter? I'm just curious if one of the ways, is it an extra way to help you get information out to the field, or are most of your sites already tapping into our e-newsletters? Or if you know that, I should say. That's a very specific question.
In Michigan, we use a lot of the content and we move it over to our what we call the connection email that goes out to our members. But we cite it, and of course the links are there and the opportunity to go to your site as well. But the content, we use a lot of it.
Great, great. Okay, good. That's helpful. Thank you.
This is Kate in Oregon. We have a listserv of our SBHC coordinators for all of our certified SBHCs. I know that some folks at the local level are already connected to national and are signed up for your emails. And we sometimes pass on things to folks if we see a webinar come through that we think might be relevant. But I honestly don't know how many folks are subscribed to your newsletters.
Okay. Great. So it could be useful to funnel that through you too. Okay. Great. Great. Thank you.
So we'll send this out in follow-up as well, but we would love to ask you two things. The first is to share contact information for individuals who you think should receive the emails and be invited to participate in these quarterly state program office learning forums. We're updating our contact list, and any information you can share with us would be extremely valuable. It could be 6 people in one state, or maybe there's just one person, but expanding our database would be very useful. And then secondly, to ask you if you'd be interested in presenting on a topic on one of the webinars during the 2015-16 school year. So if you're interested and you want to share the type of topic you want to present on, it would be great if you could share that information with us. So just to sort of reiterate what I've shared, the emails going forward will be monthly. These are the dates of the State Program Office Learning Forums for the 2015-16 school year. In the next slide, is the registration link to be able to register. And as soon as you click on this once and accept it, it will load all 4 of those webinars into your Outlook calendar or whatever calendar you use. So so you don't need to worry about writing down those specific dates. And we will also send this information in follow-up as well. So unless anyone has any other thoughts, we'll just say thanks so much for joining this afternoon. And we will look forward to speaking to you next on February 25th of 2016. So thank you, everyone. We'll talk to you soon.
Thank you.
Thank you.
Thank you. Bye.